Hi, my name is Carlene Gaston. I'm going to be conducting an abdominal assessment with my volunteer here. Hello.
Hi.
Before we start the assessment, I'd like to ask you a few questions about your health history. Do you suffer from any chronic abdominal pain?
No.
Do you have indigestion?
No.
Have you had any recent vomiting, diarrhea, or constipation?
No.
Okay. Are there any dysfunctions with your bladder and bowels?
No.
Have you ever had abdominal surgery?
No.
Have you ever had any trauma to your abdomen?
No.
Do you have any of the following GI disorders? Peptic ulcers, inflammatory bowel disease,
No.
any irritable bowel syndromes?
No.
Have you ever had hepatitis or cirrhosis of the liver?
No.
Okay. And are you up to date with your immunization status on hepatitis A and B?
Yes.
Oh, good. Have you ever had colorectal cancer?
No.
All right. And no gallbladder disorder?
No.
Okay, great. So we're going to start our assessment then. The first thing I'm going to do is inspect the abdomen. I'm going to be observing and looking at first for any discoloration, such as if it was yellow, there would be jaundice. I'm looking for any redness, which would indicate inflammation, or maybe bluish around the umbilicus, which would indicate perhaps intra-abdominal bleeding. I'm also going to be looking for any rashes, any scars, which I've noted one scar right below the umbilicus. And what's that scar as a result of?
Surgery for having babies.
Oh, surgery. You had a tubal ligation?
Yes.
Okay, good. And you don't have any striae, which that's usually a result of pregnancy or gaining a lot of weight suddenly. I'm also going to be looking at the contour of the abdomen, and so her abdomen is a bit rounded, which is normal, and I can see that it's symmetrical on both sides, and I'm also observing for the venous returns and looking for any masses or anything bulging, which I don't see. I'm going to ask you to kindly pick up your head slightly, and I can see the rectus abdominis, and from that, if there were any bulging or pulsations, any bulging or hernia, I would see from that. Okay, you can put your head down. So, any marked pulsations would maybe indicate an aortic abdominal aneurysm, and I don't see any of that. And with the any bluish around the umbilical circle is called the Cullen sign for bleeding, and none of that is noted on inspection. Okay?
Okay.
So are you okay now?
Yes.
Okay, great. The second part of my assessment will be I'm going to auscultate, which I'm going to use my stethoscope to listen to the four quadrants of your abdomen. I'm going to be listening for bowel sounds. Bowel sounds are usually like clicks or gurgles. Sometimes they can be 5 to 35 clicks or gurgles in a minute. If you have increased bowel sounds and it's hyperactive, that might be indicative of a gastroenteritis.
Okay.
And if you had very low or absent bowel sounds, that could be a bowel obstruction. And any bowel sounds with pain or rigidity would be like an emergency. Okay, so I'm going to listen to bowel sounds, and I'm going to be listening to any bruit in the arteries, which is turbulent blood flow. Okay? So first, what I want to listen to, I'm going to listen to the right upper quadrant. Good. Very good. Great. So I've listened to all four quadrants. I do hear gurgling and clicks along the way. I'm also not going to listen to the abdominal aorta for any bruit. No bruit. We're going to listen to the right renal artery, the left renal artery, the iliac artery on the right side, the left iliac artery, the right femoral artery, and the left femoral artery. Again, I don't hear any brewy sounds, okay? Thank you. Are you okay?
Yes.
Okay. The third part of my examination will be palpation. What I'm going to do is just lightly touch the stomach area, just to see if there's any sensation, any tenderness or any muscle resistance. Okay. Here, do you feel any pain when I touch it?
No.
Okay. Any pain?
No.
Okay. So I'm going to now just do percuss, which is just kind of listen to the sounds of the organs inside your stomach. The predominant sound in percussion is symphony, and that is because of the air in the intestines and the stomach, and any masses or organs would then have a sound of dullness. So first I'm going to percuss on all four sides, 4 quadrants I should say. Okay, so now I'm hearing tympani. Now from the mid-clavicular line on the left side, if I percuss up, I can then come across the sound of dullness, which would be the border of your liver. So I'm going to percuss from a place of tympani. So right here, I'm hearing a sound of dullness. Going to kind of put a little marcation here, and that's the lower end of your liver. And from the resonant sound of the lungs, I'm going to percuss down, and I want to make sure to not percuss over any bones, because that would be dullness. So right here would be also sound of dullness. And what I want to do is measure for the liver span. And I'm getting about a little over 7 centimeters. The normal size would be 6 to 12 centimeters. So that sounds pretty good. And what I can also do is percuss on the other side for your spleen. And spleen is for splenic dullness. So I'm over here, I'm just gonna try to get to the 6th or 9th rib on the left side. Okay, so it's right here. So I'm feeling the splenic dullness, and I don't see that sense that your spleen is enlarged in any way. Okay. So far, so good?
Yes.
Okay. Next thing we're going to do is do a deeper palpation, and from the palpation, I'm going to try to palpate some of the masses. So with the deeper palpation, we can then discover if there's any more pain or discomfort. Any pain? Any pain here?
No.
Any pain at all here?
No.
Pain here? Okay, now I'm going to try to palpate for the liver, and I'm going to find her rib right here, and kind of like hold on to the rib, and I'm going to ask you to take a deep breath.
Now?
Yes. Right, so I'm able to palpate the liver border. You can let go of your breath. And just below the border of the liver, Lateral would be the gallbladder, and I can try to palpate for the gallbladder, but in healthy humans, the gallbladder is not palpable unless there's some inflammation going on there. Okay? And also, over to the left side, I can try to palpate for the spleen, which would not be palpable unless there was some splenomegaly, which is any enlargement of the spleen. Okay? And also going to be palpating from any other masses, and I don't feel any masses, and the abdomen is nice and soft. Okay?
Okay.
So far, we're getting closer to the end. What I would like for you to do now is just to, if you don't mind, sitting up and facing that wall. I'm just going to see if there's any kidney tenderness at all. For kidney tenderness, what I would like to do is just put my hands over here, the left side, and just kind of percuss again. Do you feel any pain? Okay. Any pain at all?
No.
No? Okay, good. I think your abdominal assessment went well. So that concludes our abdominal assessment today. Thank you.
Finish?